Okay. Hi all. Welcome to tonight's meeting of the Health and Wellness Committee. We're going to call a meeting to order at 5:06 p.m. Today is April 27th already. I don't remember the last time we met.
December.
It was in December?
Mhm.
Okay, so there's a lot to talk about today. So first, we are going to approve the agenda as presented. Is there a motion to approve the agenda? Motion. Is there a second? I think anybody from the
Technically, no.
Second, thank you. So Dr. Goldberg motioned and
Lauren Weatherall.
are you catching that, Al? The person that's
Yes, Weatherall.
Yes.
Weatherall.
Yeah.
And I'm on the.
Thank you. So Al is going to be recording all of the votes and things like that. Great, thank you. Is there any discussion? No? Okay, let's move on to the consent agenda. So we have two items in the consent agenda. One is the approval of the consent agenda, and the second is the approval of the meeting minutes from the last meeting. Is there a motion to approve the consent agenda? Motion. Thank you. Is there a second?
Second.
Thank you.
Tanya Gilbert. Tanya Gilbert.
Thank you.
Thank you. Next are announcements. Does anybody have any announcements to share at this time? Oh, okay. I feel like we need to swap the order and start with welcome and introduction. So let's do that next. So number 5 will be welcome and introductions, and then we'll go into comments from the community, and then we'll go into announcements. So I'll start. Welcome and introduction. Yagneti Skachia for sure. I'm a school board member, vice president, and co-chair of the Health and Wellness Committee. Thank you all for joining today.
Hello everyone, my name is Dr. Goldberg. I'm an emergency physician, also a school board member. I'm a parent of kids in the district, and it's great to be here with you tonight.
Hi, I'm Alex Ray. I'm the social media manager at Sodexo. It's my 3rd day here. And I was told to come here, so. So that's who I am.
I'm Sarah Dinklage. I'm the director of Round Student Assistance Services. We place the student assistance counselors in the Providence schools statewide, and I'm co-chair with Amy Messenger on the social emotional health program.
I'm Jack Presley. I'm what am I? Let's see. I'm a parent of 2 PPSC students, Varden Gregorian. I'm on the Healthy Relationships Working Group. And what else? I'm on the PTO at Varden.
The president of the PTO.
I'm the president of the PTO. Now I'm stepping down from that role for next year, but yes, so happy to be here.
I'm Gina Sylvia, Director of School Counseling for Providence Schools. I'm under the Wellness team, and I work with all the counselors K-12 in the district.
Hello, everybody. Sandra Stewart, Interim Chief Student Support Service Officer for the district. Excited to be here with everybody.
Hi, good afternoon. I'm Susan Chin, Executive Director of Early Childhood, and I work within Sandy's department.
Hi, Amy Messenger. I am the Project Aware Grant Coordinator for the district, one of the lead social workers, and I co-chair the social emotional work group with Sarah.
I'm Alan Kushner. I'm clerk to the school board.
I'm Tanya Gilbert. I am the Partnerships for Success Grant Program Manager at the Healthy Communities Office. And I'm on the Healthy Relationships.
Everyone, Natalie Fleming. I am the new Social Emotional Learning and Mental Health Director under the Wellness Office. Sandy, I've been a school psychologist in the district, also the Project Aware Coordinator, working on the Social Emotional Working Group when it first was established 2018-ish, and then was Rosemary at RIDE, recently on the school based mental health grant there. So I'm excited to be back here supporting social emotional learning and mental health.
Welcome.
Okay, I'm Karen Weatherill, Director of Rhode Island Public Schools Coalition.
I'm Rachel Newman Green. I'm Deputy Director of the City School.
And I'm Rosemary Riley-Shaw from the Rhode Island Department of Education.
Thank you.
So are there any comments or announcements from community or guests?
I have an announcement. This Saturday, the 30th, is Prescription Drug Take Back Day. It's an event that our office does twice a year, but it's to encourage people to safely dispose of drugs. The event itself is 10 a.m. to 2 p.m. at the Broad Street entrance to Roger Williams Park. It's going to be a big community event, but encouraging everybody to come and bring all prescription drugs that will be safely stored and disposed of. But meanwhile, there's going to be dancing and fitness classes. And it's twice a year, every 20 years.
Is there a website or anything like that we can point people to?
Yes. Tanya, do you know, I think probably the things going out on our office's social media, probably.
Mhm,
So
yes.
Healthy Community Office social media has frequent announcements and project stuff.
So one thing that we have talked about kind of at length, but I don't know if we ever actually talked about it within this committee, is a way to be able to share those kinds of announcements within this group. So are you all getting, do you all feel like you're part of an email list that's coming from this committee that is helpful to share things like this? Because I know that previously, under Solite, we were communicating with everybody, but at this time, would it be helpful to create a listserv or something where we're able to just share things in real time?
I need an updated one because the other one was really old that I was using.
Okay.
So yeah.
Yeah, so let's add that to our own list to do for next time. Is to create, whether it's a listserv or a list, something. Because that's great, but it's this weekend. I would like to have a little bit more time there and share with folks. All right, so unless there are any more announcements or comments, we're gonna move on to reports. And the way that we have it listed on the agenda is reports from the various subcommittees or the working groups. But, okay, so we'll do that first and then the presentation from the wellness office. Okay, so the first on the list is the social emotional working group update. Is there a representative?
Yeah, I'm here to report on that, Amy Messenger. So through Sarah and I co-facilitate that group, and we've been able to partner with the Healthy Communities Office, OBID, through that office, and some funding has been made available for us to focus on Mental Health Awareness Month, which is coming up in May. So we, Dr. Richard Booth will be hosting a professional development titled Shifting from Trauma-Informed Care to Community Engagement, Healing, and Resilience. And that will be for all of our social workers, school counselors, school psychologists, and school nurses. Additionally, through that funding, I brought, this is a bathroom decal to go in the stalls of all of the bathrooms at the secondary level, where students can scan a QR code and be able to access a website with different mental health agencies and hotline numbers and resources and things like that. And then most recently at our last meeting, we were able to highlight some effective partnerships within our school building with Rhode Island Student Assistance Services and the social workers and psychologists and the counselors there. Spoke a lot about the work that they do collaboratively, offering mental health within the health classes and different initiatives for student groups.
Where can we, I know that you just showed us the
Yep.
flyer. Can we get a copy? Like,
Sure,
how-
yeah.
okay.
Yep, I can We have a
We have
box.
2,500 of them.
Yeah, these are stickers,
Yeah,
so they
but-
can go like on the back of the stalls. But yeah, I can get copies of those for sure.
All right, thank you.
You're welcome.
I can run up at the end, so.
That professional development is May 11th.
It is.
Okay.
Yes.
Great.
Yep.
Any more from the social emotional working group? That's all great, by the way. And again, because we met last December, I'm wondering if ahead of these meetings, we can get sort of like bulleted points
Oh, sure.
from each group ahead of time, so we could read it, look at links and things like that, and then be able to, then we'll hear from you in real time, but also get to share things ahead of time or after, right after, instead of waiting for the minutes.
No problem. Yeah.
Which unfortunately, I think we just keep for archives and people won't actually read them.
I think the only other thing that comes to mind, I forgot to mention, we are working with Janet Pichardo through the Family and Community Engagement Office to recruit some parents to be able to attend those working group sessions.
Thank you.
You're welcome.
Question for you, Amy. Are we tracking how many students are getting referred through this flyer? Because I know with QR codes, you can actually collect data
Oh,
from how many
that's
times it's scanned. And I just wonder how great the need is and whether it'd be worthwhile for us to assess, is this a worthwhile campaign? Should we be continuing to do these type of bathroom stall campaigns, or
yeah.
is that effort not worth it?
I think that's a great idea. We got assistants from other departments in the school, so I'd have to ask if they track it, but that's definitely a great idea. I do know last night we were on the Student Advisory Council meeting, and one of the students, these were distributed last year in May, so these are to replace, different ones that might have gotten torn down or are damaged, but one of the students said that she knows that they're in the bathrooms of her schools, and she felt like that was a great way for students to be able to access help without it necessarily having to go to a person in the building or do it more privately. So we do have that feedback, but I like the idea of tracking through the QR.
Yeah, typically you can, and then, if we see that there's huge need, then that's something that we can pursue.
Yeah. Thank you.
The Project Aware grant is tracking that information, but through like actual screening once there is a crisis. So that would be really great data to add to that preventative measures. Yeah.
Yeah.
Would we be able to just get Providence, or is it get lumped all?
No, we can get just
We can just-
Providence through Project Aware.
Yeah.
Yep.
Any additional questions or comments for social emotional working group? Okay, so we're gonna move on to healthy relationships.
I actually have the update for that. Lisa was not able to join us, so she asked me if I could share a few things. First, she wanted to welcome Moya Williamson, who's the new co-chair to the group. Secondly, she is really excited about PVD and how we are updating our curriculum to meet the new RIDE requirements. She also wanted to share about the link to the partners to the district. She really liked that idea in providing teachers and staff professional development. She also had wanted Karen and Jack for me to give you some time to share, I think, the assessment. And then she also wanted to share the continued support for the free menstrual products in the bathroom, which was an initiative that Solite wanted to make sure we followed up with. So Karen, I don't know if she wanted me to give you some time.
Sure, thank you. And thank you so much, Sandra, for your support. We had our first meeting and really happy to be working under your leadership here, because already we've made some good progress on several initiatives. One that we've been working on out of this committee was an assessment on adolescent sexual health that is a self-assessment. It's only staff in the district. Students are not taking any kind of survey. And the results don't go to RIDE, don't go to the health department. It's really for the district and this committee to review. We developed it based on the CDC School Health Index. So the questions were pulled out of the School Health Index, those that related to adolescent sexual health. And there are 5 areas. One is education, sexual health education, what's being taught through health education. One is access to services, So either now, maybe in the clinics, there could be, but mostly it's referrals and ensuring that everyone's doing the same thing and everyone knows what they should be doing and what sort of laws are around that. The third is school climate and connectedness, then parents' engagement, and community involvement. And there's about 4 to 7 questions under each of those categories, and they address both policy, so that's more school board, and I don't know if either one of you, we did send it out. This was the beginning of the school year. We didn't get many from the school board around policy, if these things are in policy, or then I would even say in some districts are looking at protocol, may not need to be an actual policy, but maybe there should be a protocol for the district. Certainly around the health services piece, we've heard that in other districts about nurses really wanting to have, or other staff that are engaging with students around some of these issues. And then professional development. So we had, working with Donna O'Connor, she gave us the opportunity, Lisa and I came in this room and addressed all of the nurses in the district one day on a PD, and then all of the health educators on another day, and they all completed it. So we had terrific feedback. So we took that, and then that's when I met Jack, and I think you neglected to say professionally what you do.
Oh, I did, yeah. I'm a physician. I work at Hasbro. I do primary care for teens and young adults, and I do research around sexual health. So it was a good fit to talk about this. Yeah, and so I can say more, but basically we're looking at the data right now. So one thing I think I was hoping to hear from the group is kind of what questions people would want to hear the answers to from this data. So there's a lot of questions that people were asked, and a lot of the things that you mentioned in terms of the categories. So, you know, it would take a really long time to go through it all, one question at a time, and it's probably not useful. So would be interested to hear what people would want to know based on Karen's description of the survey. And then we'd love to come back and kind of do a little bit more of a formal presentation and give you a sense of like what the responses were. I'll just say, kind of building what you were saying, I think there are some of the sort of like administrative, kind of like district level, like school leader level kind of questions. And then there's the sort of like questions that really made sense to hear from the teachers and the school nurse teachers and the health educators. So I think we're trying to parse that out. But yeah, so curious to hear what people would want to know, and then we can come back and give you some more specifics.
So we were looking to see when we could schedule that. And we thought the first thing, either we'll probably in our or our working group talk about it, but then have a more not formal in the sense, but, and I think along with some context to better understand why is this important, and how does it connect with the other goals and responsibilities of the district. And I do want to add that Jack did one of the parent universities, someone mentioned Janet, which I saw did a great presentation for parents on how to talk to your kids. And it's just really important that I think that we do engage parents in this, but that it's a regular part of development, and we really want to support students both in what they're learning in their health education classes, and that includes supporting your educators so that they're comfortable and they're confident in teaching medically accurate, inclusive, and meeting what the instructional outcomes are of the health education framework. So yeah, any feedback on that, and when we can talk about that after, but when we might want to make that presentation so everybody can see that data. And I think that will give us the foundation to then be able to say, what are we doing well? Where do we need to put attention for improvement? And then one of the things that Lisa didn't mention, but do you mind if I just, this was a project. So we are working with the Department of Health on this project, and their goals really around reduction of sexually transmitted infections, which we've seen are chlamydia is very high. We can look at Providence specific data if we get to that after we look through the survey data that your staff completed, and then take a look at some of the data that the health department has. And so we've done this work with other districts in doing this assessment, and then from there offering professional development. And out of that, someone had a great idea, because we always share information on the Right Time app. So this is a phone app that anyone could put on their phone, and it wasn't designed specifically for use by the health department. I love the name Right Time. I think it took them a lot probably to come up with what the appropriate name was for this app. But essentially, it has information on healthy relationships, prevention, testing, and treatment of STIs, sexual reproductive health services and locations, where to get free condoms, birth control options, even an Ask the Expert. And it's just, there's videos on there, like accurate information. And we know that too many youth are getting information about their sexual health through not very reliable sources. And so we made these posters specifically for schools, because it was a nurse in another district who said, wouldn't that be great? And just tried to make it, we worked with the youth health ambassadors at the health department to get their input and learn about private stuff in a private way. And exactly what Sandra said, we put this QR code on here and are giving enough. I think there are 50 there that Donna O'Connor asked at least, and there's more too, but we did it for in the nurses' offices, in the health education offices, and maybe other districts were putting them like in locker rooms. But you guys were smart with the sticker. We weren't that clever. I wrote that down. So that's an idea. So this is a first, and other districts are using them too, and maybe we'll go that route. But, so that's something else too, out of that working group that we were doing.
Can I make a couple of quick points about the free menstrual products? So we're in the middle of figuring out that in the past 2 years, I guess as a pilot, our office provided the funding for the dispensers and the products and the signage and all that sort of stuff. And we're actually at a point right now where we're trying to figure out what the next step was. So it's good to hear that folks are encouraged and continuing to push that forward. One of the changes since we started, obviously, is now mandated by the state. So we're trying to figure out, now that it's mandated by the state, is the funding from our office still needed to support that, or is that someplace else in the school? And Jamie Audette, before she left, had reached out and said, why isn't this just in the regular custodial budget? I don't know. So, and then she left. And so now I've talked to facilities and we're trying to figure that out. So the next step, if that's, and one of the things that we had talked about next steps was figuring out how to do some kind of evaluation of that program. And then we were in that conversation with Solite, but that was before it became mandatory by the state. So then we sort of thought, well, what would be the purpose of an evaluation if you have to have it at this point? Would that be a lot of energy not well spent evaluating something that is going to be continual regardless of what the evaluation says? So there's sort of where we left that off. But we're trying to figure out, we do have funding from our department in the fiscal year 22 for those products. We're trying to figure out if that funding is needed by PTSD, and we're obviously putting together our budget for fiscal year 23 right now. So trying to figure out, are we doing that as well?
All good questions. But I still think there should be an evaluation, only because, are the students actually using them? What do they prefer? Is it accessible?
Right.
Even if it is a mandate, is it actually happening? Is it actually accessible? Is it actually in the stalls and things like that? Like, sure, there's a document somewhere that says that this should be happening, but is it happening? Is it happening?
Yeah, I think that those are also very good questions. I think one of the things that we had brought that up when the Healthy Relationships work group was setting their goals for next year. And I think folks sort of felt like figuring out that evaluation and how to do it was beyond the scope of that subcommittee. So it's sort of who and how, especially considering the challenge of getting data and stuff. And that's sort of where we asked about.
Well, now that we have an office of wellness,
I'm already turning.
Let's talk about it.
Maybe let's talk to Aramark or whoever's
Yeah,
providing
I'll talk to
those
Sal.
services and get an idea of how often we're refreshing those bathrooms.
Yeah.
I think in terms of the sexual health survey, I'm really interested to hear those results. I think I've heard thus far that it's been sort of inconsistent education. I'd love to know where where teachers want us to go with the PD and how we can fill that need and just general comfort around talking about that topic.
Would you like to see the survey itself to see
I
the
would love
questions?
to. I thought I answered the survey question to the school board
Oh,
member, but
so maybe I can't get on, I'm not, I really, maybe the code changed, I'm not, so I can't look to see. But maybe you did, maybe you
I
did.
think I'm aware of the question.
Okay.
But
So,
Yeah, okay,
okay, so
thank
you
you.
know that,
I
yeah.
looked at the data, so.
The hard thing was, so typically I will say in other districts, when we began doing this, we did it as a group activity. There were smaller districts and had a facilitated discussion, which on the one hand was interesting because there was discussion. So someone might say, well, we're doing that like at the middle school, and then someone say that's not happening at the high school. Here's where, oh, we didn't realize we had a GSA, so we're doing some work in that area. So it was like it was a very robust discussion. I think the limitations of that is that some people may not be comfortable speaking up to say, no, I don't think we're doing a great job at all. They're kind of there, so they're not comfortable speaking up. So we didn't have that option in Providence. There were so many staff. So we had to modify the survey because, as Jack's saying, if you're asking a question about the delivery of health education, your nurses or school board are going to be like, I don't know. So we have an I don't know in there. So in parsing it out, and this is where Jack's been really helpful, we want to make sure that we're looking at questions around the delivery of education, and are they covering these best practice topics, and all the questions, we're looking at the answers specifically for the health educators and not including all the I don't knows, because it would be, and the same thing when it comes to health services, that we're really able to pull out the clinical staff, the nurses, with those questions.
Right. We don't want to like skew the results by including a bunch of people who we don't really want them to know or expect them to know the answers. So that's kind of what we're working on now. But yeah, I mean, definitely can share. There's definitely lots of interesting points about teachers and what they're saying they want in terms of professional development. And I think the short answer is a lot. But yeah, I can give you some more detail about that for sure.
one thing that is good to be aware of is we just approved, and Finance Committee is coming to the school board tomorrow, but we just approved a new high-quality science curriculum for K through 8th grade. So it might be a useful time to look at that curriculum that we approved and see if there are any units on sexual health, and how this survey may overlap with those units. But in general, I think the more we can be consistent and sure it's happening at the same time, and that all the students are getting the same information agriculturally and used appropriate way, I think. So that's a goal.
And would this be, Sandra, a time just to mention the professional development this summer that we're looking? Okay.
Please.
So, Rosemary, we're working with RIDE, Rhode Island Healthy Schools Coalition, on a larger project around updating the health education framework. So this is the document that districts use to develop their curriculum. And it needed to be updated, and we had a advisory committee that we've worked with, and we're in the process now of just really it's being reviewed and endorsed by the council. Okay. So as part of that, we did learn that professional development is key, and we were able to, Rosemary, secure funds that we've offered already once on a PD day in March, a statewide PD day, where we had 60 health educators from across the state, K-8, teaching different grades down. We're offering it for a second time on May 11th. And this is we're bringing in facilitators from 2 different organizations, national organizations, RMC Health, and then Parent Guidance, who have a lot of experience, expertise in health education and working with other states in this kind of work. And it's on how, for help, doing a really deep dive into how health educators can teach based on the skill standards and learning strategies and resources with that, because it's tough. There's so much information and content for them to cover and not a lot of time. So we got really good feedback from the first one. Oh, we did do a session even before that, a 8-week virtual session. So we find that there are more and more health educators that are just clamoring for this. And Do you want to speak, Rosemary, with your conversations with Donna O'Connor?
Sure, and then so Donna O'Connor reached out to me and she said that she would like a separate training for Providence. And so, you know, we were using some of our federal dollars that we have around mental health, behavioral health, and made the case that skills in health education are behaviorally based. And so now with this, the Providence training, I just spoke with our project officer for the US DOE grant that we have here on school-based mental health, and this idea of being able to utilize some of that funding that we have at the state level to train the health and PE teachers, and then have a smaller training or shorter training where the school-based mental health professionals could also hear about the resources connected to the skills in health education and as a pilot, and you know, seeing how this kind of opportunity to you know, share language and resources can help build a bridge across health and PE teachers and school-based mental health professionals. So they were really excited about the idea, and so I have like a preliminary approval, and I just have to, you know, dot the I and cross the T on that. But I'm really excited to be able to highlight that as well. It's just been really overwhelming and heartening, actually, the response that we've gotten, you know, across the state for this kind of training. It's very much needed.
So we're looking at the August, has the calendar been approved yet?
I think tomorrow, we're looking at it tomorrow, the calendar.
The calendar from school.
The
year.
school
For
year.
next school
So
year?
with
I
those
believe so.
PD dates in August,
we
so we're
should
looking
know
at that
something.
week in August, and I guess we sort of have that tentatively.
Mhm.
And I wanted to just mention, I went back to the facilitators, and so we actually have, maybe I did that. I can't remember, I'll have to get back to you, but it was like a Friday, and then there were 2 days, so we thought we would, because the staff is so large, and we want to make sure that it's engaging and interactive, and it works best when it's not such a large group, we would split it, so we'd have the elementary on one day, and then the secondary on another day. But we wanted to try to nail those dates down, because we have some, you know, conflicts with the facilitators.
So
So,
hopefully tomorrow.
okay.
Hopefully tomorrow.
I had a question as well. 2 different conversations, it was brought up about LGBTQ plus sexual health. And I didn't know whether the curriculum that you chose addresses that, and whether the app addresses that as well.
The app, the Right Time app definitely does. And I don't know about.
I don't know
curriculum,
what is in the new science curriculum for sexual health in particular.
Sure.
I would have to ask our science curriculum person who, I do think we'll be at the school board meeting tomorrow, so I can try to get you the answer to that.
And I know we've been, in our committee, have been trying, and I know Lisa asked you, Sandra, now, to get just a digital copy of the health scope and sequence, and that's probably where a lot of these topics are addressed more fully in health education under human sexuality than in science, probably. And so we do want to find out, it's several years old, has it adapted, how is it adapting, is it inclusive? And I would say that this self-assessment that the health educators and nurses did take, that section on school climate and connectedness, most of it does address the LGBTQ plus community, and even in the delivery of health education, that is also specifically called out. So teachers would have responded to that, and we'll find out whether how is that being taught? Is it inclusive? And again, how are they comfortable? I think we realize we can't have an expectation, especially around a topic that can be sensitive, that most health educators have been teaching it, but there are some, I don't know specifically in Providence, but certainly around the state. I mean, I've heard all kinds of things, but some people saying, I'm not just not touching it. And that's not what we obviously don't want that. So I think it's incumbent on, professional development, right? So that they then become comfortable and confident. So absolutely, I would say we'll be, digging into that more.
I'll check with the TNL team because I'm not sure about the science curriculum. So I'll have to ask them, but I think it probably lives more in the health, which I just got access for the digital copy. So we'll have to check that.
All right, thank you.
And I know the nurses have been getting some professional development around that. I know Donna has scheduled some, and I think the social workers, and so we have started supporting our support team with that. But I'm not sure curriculum-wise for students what they have gotten, so we'll have to check that.
I would just say too, with the health curriculum, it has a mental and emotional health skills built in too. So something that, we've been talking about too and looking at and considering social emotional learning and mental health at the universal level and tier 1 support, how we're integrating that into the classrooms. And Rosemary and I talked about this too, is that language. So as we're rolling out, trying to make sure that we're just using that language across the board, so that when the health teachers are teaching their curriculum, the school counselors are supporting, the teachers are supporting, we're all kind of using the same pieces and promoting that skill in the same way. So,
And these are the conversations that are great with the new wellness office because we have now brought all of these departments together so we can have these cross conversations. So that's been one of the great things. So,
sure. Yeah. And the other thing I was going to ask is, did we have a copy of that survey? I'm just thinking the school health index also has the school support services. And, if we could maybe, that might be a next step for the school site and school social workers to fill out.
Okay. Do you want me to just send it directly to you? It's on our website, so
Oh, it
it's
is.
pretty easy to
Okay.
find, but I could send it to you directly as well.
I can look on the website. If I can't find it, I'll reach out.
Okay.
That works.
What is the website again?
Okay, so it's RIHSC.org. That's Rhode Island Health Schools Coalition, RIHSC.org. It's really pretty simple. Just go to the top menu and there's, click on wellness topics. There's a drop-down menu and one is adolescent sexual health. And when you click on that, you just scroll down a bit and it will have it'll say something about like self-assessment tool or and resources, something. Click on that and you'll see it. It's available. And we did it as a Google survey or you can copy a PDF of it. There's lots of information there too, which has been.
it's a great resource. I love the newsletter that gets sent out. It's a lot of great information. I was actually going to show it at our Thursday meeting, so I didn't know if people realized that was out there. So I
And we
showed that
actually
this
have on there too, so just take a little look, and if you have any suggestions,
Yeah, it's
social emotional health tag as well, a page, and I know that I'm using some of your resources around, or mental health and social emotional health, so I said, but some of the resources that you all have,
We have to highlight Providence though for Mental Health Month in the newsletter, just so you know. I want the profile on the
Okay.
just so you know, because we got some good things coming. So
Okay.
we want to be on. Yes.
So I want to pause to give an opportunity for our two newcomers. They're not new to the meeting. They just got here a little late to introduce themselves. Yeah, go ahead.
Yes, my name is Tyrell Stevens. I'm on the Providence School Board.
My name is Kelly DeAngelis. I work for Sodexo on sustainability and community data.
Thank you. And again, Sandy, we're gonna have to talk about just putting it out there. Needing more than just a listserv, a way to be able to share all these resources, because I love both of the flyers. And if I'm not in the school, I'm not going to see it. But I'd like to be able to share it. So let's figure that out. I don't know if we can connect with communications for PPSD. Maybe they can post it and we can reshare within our various networks. But yeah, that's great. Unless there are any additional questions or comments regarding the Healthy Relationships Working Group, we are going to move on to the Nutrition and Physical Activity Working Group.
All right. Okay. I'll give you a bit on that. So our working group last met on February 9th. And I would say that soon after, we learned that Solite was leaving, and I think we didn't know what was coming next. So I'll say we haven't had to cut much after that because we know the direction that this work is taking. But we're very excited at the direction it is at. So, one of the updates, I think folks know that Linda Grossi has retired, so she was really taking on the leadership of the physical activity aspects of the committee. And so we are needing somebody else to sort of speak for that. I often was taking on more of the nutrition and food issues parts of it. We have the group together work on setting some goals specifically about developing opportunities to embed nutrition education from URI SNAP Ed curriculum into the multilingual learner classrooms, looking at all the opportunities in the 4 different pillars of language learning that food and nutrition can be worked into there. So reading, listening, speaking, and writing. 2 of the committee members, Carolyn and Paula, were specifically working on that. Their long-term goals, I think that if Carolyn works at ASFS and working with teachers there, I think long-term goals is to develop a package of lesson plans that can be distributed throughout the district. So one of the hanging questions we had was, what are the next steps of that? Who can they go to bring this to the district and have it disseminated? But they, I think, had a lot of great success. And as you can imagine, in learning language with kids, there's lots of things about food we talk about, so that can be really promising. One of the goals that we have set is to get a status update on the farm to school plan. So that was established several years ago as a way of better increasing knowledge of local foods, integrating more local foods into food service, and figuring out how to talk about food systems in the curriculum. And thanks to the work of Kelly and some members on our committee, that work has been, frankly, moving forward very well. Kelly's been doing tremendous work with the school gardens and with all sorts of things like that. The challenge that we've had is that we haven't been doing a great job sort of tracking it to the plan that was laid out. And so one of our goals was to figure out how to really do a real update on that. Look at the goals that were set a couple of years ago, figure out what's been accomplished and where we are and what next. So the other thing that was identified as a need to support teachers was really doing a real assessment of all the school gardens out there. Last count, I think there were 19. Somebody to put an eye on them, figure out where they're all at, who's the contact information for all of them, which ones need what kind of support. So my task was to identify a university partnership to help with those 2 bodies of work, because we really need some energetic people to put their legs on the ground and go out and do it. So I've been in conversation actually with URI Cooperative Extension. They are starting a Rhode Island Agriculture and Food Systems Partnership. It's a paid internship, year-long internship. So I was talking to them about bringing, the program starts in January 2023. So maybe getting some students in to do that work. So I think it would be very cool and very interesting. I think a lot of folks who are involved in that are as I'm sure folks know, URI Cooperative Extension has tended historically to be much more rurally oriented, but always wanted a way to work with the urban communities. I think this would be a really meaningful way for folks at the university to start learning about what food systems mean to their province. Let's see. Another task that I had was about doing a map for teachers, either potentially for the multi-language learner, but it could be for science classes, it could be for art classes, it could be any sort of thing, to map where nearby gardens are to the schools for walkable field trips, and to develop the connections between whoever the leaders of those gardens are and the teachers. So that's still in process. We have some new mapping capabilities in our office that are super exciting, but I think there's a lot of human connection that needs to be made also, especially making sure that teachers are aware of these resources and that they have. I know that there was, at our past meetings, some conversation came up about the greenhouse at Lisa Messer. Lisa Messer has a very cool, I think, largely unused greenhouse. And I know that Kelly had sort of asked what supports they need. I don't think we have a status update on that yet, but that could be a really great opportunity for it. At our last meeting, Karen shared a couple of professional development physical activity opportunities, one on March 14th and one on May 11th.
Those are the ones that we talked about.
Those are the ones that you talked about. That's what I thought.
Providence
Okay.
will have their own PD training this summer.
Sorry. As you were talking about them, I was like, I have those on my list. Okay. And Dr. Goldberg had reached out to our office months ago at this point, some time ago, about opportunities to be provided water bottles to students to make sure that they were accessing clean water in schools. And I think at this point, as I understand, the process is sort of holding at identifying what good locations for like a pilot of that would be. There's been a lot of sort of operational questions. How many water bottles? How do they get out there? How do kids use them? What happens if they use them? All that sort of stuff. So I think the idea is a pilot and figure out how to move forward with that.
I've worked with you on that, Rachel. Several years ago, I worked with the Department of Health on a CDC-funded pilot project. There were 3 districts. Providence wasn't one of them, but where we did, and we gave information inside the water bottles on the importance. So I have a number of resources that could be used. And I don't know if you had, they were specifically in schools that had the filling stations because there was a way to easily.
Right. I think that was one of our questions, was identifying which
did actually approve in finance committee a month or 2 ago, the filling stations, or automatic filling stations for the vast majority of the school, prioritizing those schools that either didn't have them or aren't going to have construction, which will tear them out. And so I know Zach Scott has been working on identifying some schools for a pilot, but it'd be good. I can loop back with him and share what we've learned so far.
That'd be awesome. And I think those are my updates in general. I would say that a lot of times our office, I have it actually. Kelly at our subgroup meetings often will give us the feedback that she's getting from the community or what she's collected from in terms of surveys and what activities they're doing in the cafeterias and that sort of thing. And what I've put out there as what I would love to have as a future goal is she delivers this information to us, but it feels like it's really useful and interesting information that would be great for the community to have more of a way of engage with and give feedback on. And so one of my goals going forward is to figure out, I've said to Kelly, I don't want her producing reports just to produce reports. That doesn't help anybody. So what's the strategy that we can get more engagement with all this data that Kelly is reporting, and also the work and what she's reporting on the changes and responses to the data that's that. So
can I just mention the physical activity, the Recess Rocks?
Yes, please.
Okay. So for those of you, there's a program that RHE is involved with called Recess Rocks Rhode Island. It's 8 years old now. Blue Cross Blue Shield is the full funder of it. It's their largest community investment program that they make to date. And we work with Playworks, which they're a national nonprofit. And Sandra has been through the training. So the training, we created this program, Recess Rocks in Rhode Island, for Rhode Island public elementary schools. We've had well over 100 schools across the state take part in it to date. And in the early years, we had cohorts specifically for Providence, and we probably have, I'm forgetting the number, maybe 12.
I was going to say 11, 12.
11 or 12 that went through it. There's been a lot of staff changes since then, and Sandra's an example who was at George West and went through it. But the idea is that a cohort from the school, and we learned after the first year, principal needs to be involved for sustainability and for leadership of that, and PE teacher needs to be a part of the team. And then whoever else the principal wants on the team, oftentimes they're recess supervisors, they could be classroom teachers. What we're finding now is that when we started this, it was really focused on same program, but the goals were around making sure that kids have safe, fun, active play during the school day, particularly in a city setting where there may not be as many opportunities for safe play, that having it in school is so critical and important in getting them then re-energized for the second part of their day. As you may know, after we really started this almost and then worked to, there's a law that was passed that requires 20 minutes of recess for every elementary school. So it really helps principals kind of set up, procedures around how do you get the equipment out, how do you even include some of the older children in leadership roles, what are some cooperative games. What we're hearing now is it really is like an SEA program that especially after the last couple of years, kids don't know how to play, there's more anxiety, there's more conflict on the playground, and they teach some conflict resolution strategies. So for the last few years, before COVID even, it just didn't seem like we were able to. We had the original cohort of the Providence schools who went through, and then there didn't seem like we couldn't get anything really going with more schools. So went back to Sandra and said, could we do offer a consultation where the coach from Playworks would go out to any Providence school interested, because there are some that are really rocking it and are doing a great job. So do you want to?
Sure. So there's some schools that are doing phenomenal and have continued it. So I recently just put out a survey because we've had a lot of changeover with a lot of, our leaders and whatnot. So I just put out Google and I survey just asking who's doing it and kind of where they are, if they could rate themselves. Like, do they think that it's been, that their implementation is really successful? Do they think they need some support? And then anyone who doesn't, who would be interested in having the consultation. And that's how we started when I was at West. I had them come out and they just come and observe, take notes, and then they met with me and they said, here are all the, the challenges we see. And anyone who knows who's been at West knows I had no playground. All I had was a blacktop, but we made the best of it. And it was great. It was a phenomenal training, one of the best ones I've been to. It really brought community amongst my teachers too when we went, and it brought a lot of structure. There was a lot of mindfulness in, a lot of, the breathing that we do with the kids as we get them ready to go back in. And the games, I think the adults when I went had more fun than the kids did. And, we had bought, nice recess bags for all the, it was just really, really great. It really changed how our kids, we had a structured play. And it was just really great. So I've already gotten some principals who have, emailed me personally, oh my God, can they come right away? Who are really interested, because we are seeing a lot of socialization, a lot of conflict out on the schoolyard. A lot of kids are having trouble socializing. Some of our K-1 students haven't had to because they, some of them were virtual up until last year. So there's been, and some of them weren't bringing kids out because of COVID and the restrictions. So now we're starting. So it's kind of reteaching everybody again what's the good playground. And it's one of the things that I love about Playworks is, it's a structured, so it's inclusive. Everybody, and kids have choice, and we teach the kids how to have, choice, and so it's really great. And you have your own. We had our own Playworks team at my building that trained the teachers. We made all the teachers play the games, which was fun. Even though they didn't want to, they had fun. So it was just a great way for kids to have fun, and it wasn't, who's chasing who out on the schoolyard and kids getting hurt and that kind of thing. So I'm glad that the principals have been really excited about it. And I figured once we know those schools that are doing it really well, we can schedule, some principals to go out and see when it's implemented how great it is. So we're in the middle of collecting all that now.
And then we can make a plan. And so for the schools that have not had the training, could go through the 2 full-day training with recess teams. And I agree with you, especially now we're seeing everyone, right, is sort of limping through the end of the year. And there's a lot of, I just think, when you said that, I've heard that from other principals too, that it was really like a team building activity. Because here you have your principal with you in sneakers playing games, remembering what is it like as a child to learn and to play. And as Playworks always say, the power of play. And I think right now, everybody can use a little bit of that. So we can look at what your schedule, what the opportunity would be like to go through the training. And then for those who went through it, but say we could use a little support.
Refresher.
Since then, we have a lot of different supports that we've developed. That it could be the consultation visit. It could be, we have something called Playworks U, where it's a digital platform where there's trainings and videos, and they could be used at faculty, meetings. So whatever it is, we'll
and it's
figure
free.
that out.
It doesn't cost us anything.
Blue Cross
it's free, and the consultant comes and helps you as you're through that implementation. Comes out and as you're implementing, gives you feedback, and comes in, watches as you're starting to implement whatever you're doing on the playground. They come out and watch you, and so it's really supportive. So I'm really excited that a lot of the elementary schools are getting excited about it. Hubris remembers too, Playworks. When we
Yeah,
were-
Kazarian was one of the
Kazarian,
first schools.
VZ.
Yes, yes,
VZ was another.
yeah, Fogarty, I think.
Fogarty.
still has a really
Fogarty
robust
has a robust.
program.
And then the other one was, what was her name? She was like a rock star. We had NBC 10 went out there and we did a
VZ,
whole.
That was
Dr.
VZ.
Haswell. Because they
Wasn't
did
VZ.
Channel 10
Colleen.
went there too. Colleen. Yeah, Channel
Yeah,
10 did
yeah,
a
who
story
else?
on her.
It's okay. In the
Yeah.
interest of time, in the interest of time, I love this enthusiasm, and I know we haven't met in a couple of months, but I know we also still have a presentation
Yeah.
slated. Were there any other updates in nutrition, physical activity? No?
Can I just add quickly, if you just consider the intern, we're trying to build our relationships back with Rick and other colleges and universities who are using interns more intentionally around social emotional learning. So the school psych, the school social worker, and the school counseling interns could support. I think that with even the practicums and secondary who just need 16, 20 hours a week, that could be open evidence-based things that can help with more inclusive practices and some other support. So
Good idea. Thank you.
Before the presentation, I just want to say I will have to leave at 6:15, and I don't want to think whoever's presenting, I'm walking out on it.
Understood. It's very difficult with this meeting in particular to keep us in timely
Well,
fashion
you
because
know,
we also haven't met in a while, and I want to
Yeah.
give people an opportunity to see each other in person, and this
Yeah.
is, there's a lot of topics that fall under health and wellness.
Yeah, normally we cut this short, like right around 6:15, because we have a 6:30 regular school board meeting, but we pushed that to tomorrow. So we could hang out for whatever, but we can't. So we have two more, we have one more update from Sodexo, correct? And then we have a presentation from the wellness office, and then I'm taking some notes. Sandy, maybe after we can talk about how, we're gonna be structuring all of this moving forward, and set up a regular cadence of meetings and not have to wait 4 or 5 months in between committee meetings, for us to meet, so.
And I think in general, like once we have this listserv set up, it'll be much easier to share informational items, and then when there's discussion topics, we can use it to that. Make sure we're really maximizing the time that we have together.
Yeah.
So we'll hear from the Sodexo folks.
Okay, I'll try to keep it very brief. And Rachel mentioned the metrics, which I don't have today, but for today I'll provide the update and then I can follow up with the big update of the actual report.
Can you help with that?
Great looking plate there.
Are you hungry? We're all hungry.
This is from our Future Chef competition. I didn't really see too many pictures in, but that was the winner of our Future Chef with their chef partner from Sodexo, and this was the dish, the stuffed peppers. So this was a student from BZ Elementary, and she did a great job. So I'm just going to go through some highlights of student engagement, some special meal distribution numbers, a next quarter preview, and then I'm happy to take any questions. And there's always so much. I try to squeeze it down, and I'll try to be quick. But I wanted to highlight 3 things: the farm to school activities. So we've done, this is a December to March update, just so you know. So in that time, we've done outdoor plantings. We've done 6 new indoor garden plantings as we roll those indoor gardens out to all of our secondary schools. We've done harvest and composting and replanting. So providing support to those teachers to keep that going in our special education classrooms. Parent and community engagement, I really want to highlight this one. I've been in close collaboration with the PBSC Family and Community Engagement Office. Janet Pichardo, she was mentioned before, was instrumental. We did parent university presentation in the fall, and we reconnected with her to develop a survey for parents, and we did a presentation and got feedback from the Parent Advisory Council, the PAC, which was very valuable. We also got some FaceTime with the commissioner, who kind of really challenged us to, step up and continue improving school meals. So we got, over 900 responses to the parent survey, which was awesome. And we also have done additional advisory meetings. And we're going to be, we're working on setting up a parent working group specific to food service so that we can keep that feedback loop going. Student engagement is our priority. We need to know what the students want so that we can deliver because they are our clients, our customers. We want to keep them fed and happy, and that allows them to perform well at school. So we've done advisory meetings, and I want to thank Tyrell for connecting us to Central High School because that was really instrumental. We heard their feedback, their concerns, their issues, and we worked to address some of them right away. One of those things was like bringing back the garden bar. So we've done some improvements. Sandra helped to get hot lunches in all of our elementary schools, which were still kind of a couple dragging. The return of the garden bars, made to order delis. So we're bringing those things back post-COVID that we know students will enjoy. And that was really, hampering their school meal experience. We've done cafeteria promotions. I mentioned the Future Chef. And we've launched a student survey to all 15 secondary schools, middle and high. And that was like a result of the parent advisory survey. So we took that parent survey, kind of trimmed it down. We want to know really basic what students want. I want to highlight, this is a lot, but I want to highlight these are our holiday break distribution numbers as well as distance learning. So on distance learning days, or the day before a distance learning day, we do a take home for elementary and middle school students. So we have all of those listed. And then before a school vacation, we do a grab and go distribution at our 7 locations that were active all through COVID. So we had those for, December break, February break, and just recently I included the April vacation as well. But, those numbers just keep going up, close to 9,500 at that time. So it's a huge lift, but it was very successful. I separated those April numbers here. And as the next quarter preview, want to think about that student survey. We've already gotten 727 responses, and we're going to keep going. We want to get as many responses as possible, and we want to be able to use that data because ultimately the goal is to have students decide what they're serving in each specific school. And we've designed our management team to reach that goal. We've done rice taste tests and recipe development that have come out really good, so I'm very excited about that. And district gave us feedback and students that they want rice every day. So we're doing rice every day in May, different types of rice, new recipes. We also had a Johnson & Wales dietetic intern who helped us with that.
It was good too, I have.
It was good.
Kelly, you have to bring some next time.
I know. Yes, we would love to do
They
that.
have a lot of great meals coming up.
Are you doing the brown rice? Is that so? Brown rice versus white rice, but also we have new recipes. So we're doing like different types of rice with beans. So like this one that we did was kind of like a yellow rice with kidney beans, and it had the green olive. It was really delicious. We've got like
Well, like the Spanish style.
Spanish rice, and one with black beans, all different styles. And I mentioned we're seeking PPSC parents for that food service working group. We're hoping to have a meeting in August or September. And we have someone at RIDE who is helping us get that information out. We're going to start advertising on social media. Janet helped us put that word out. We've got to do some more work to get parents who want to sign up and participate regularly. So I think that's it.
Kelly, you want to talk about the backpack program too? So one of the things as Natalie and I have been meeting with the smart clinics, what they're seeing is there's a lot more food insecurity. They're starting to see very huge numbers. So thanks to Kelly Quick, who's going to be giving us some more backpacks so we can send them to families. So when they're going to the smart clinic, we can, get these kids, put into the backpack program. And that's at the middle school and the high school. We're seeing that right there out of 2 schools at the smart clinic. So thank you for that.
Yeah, no problem. So that's weekend meals that will basically, carry students who are who don't have food at home. It'll take them through to the next school day. And so it's kind of like a discrete program that we don't want to advertise too widely, but the principals or the nurses, you know, the professionals at the school can reach out directly to Sodexo and just give us the number of backpacks they need, and we'll have them ready on a Friday, and the kids bring them back on a Monday for the next week.
Well, Kelly, I want to thank you and Mr. Jeff. You guys are doing a very great job as it pertains to the lunches. I know, for a prime example, with Central, a lot of the students made that like a priority when I went on a school visit there.
Yes.
And I said, I'll reach out to Sodexo. When I reached out, you guys met with them. One of the main things I would say, I would even ask you if we could try to build sort of like a bond, because I know at Central High School, it's the community specialist, and then what is her role? Marilyn, yes.
The manager.
Yes,
she's great.
They
Yeah.
both have a relationship, the community specialist there in Maryland. So we could try to get that in all the schools where they're able to build that relationship and students are able to go to the community specialist about what they need and take surveys and get information related to them. I think that that would be a plus for the district and Sodexo as well. So I want to congratulate you guys. Well, thank you guys on that.
Thank you. And that's a great idea because we're really trying to build student advisory boards at each school. But I've talked to Sandra and Janet, you know, finding that group of students who want to participate is a challenge. So that's a great point.
And absolutely, really quick also, students have reached out to me and they have said that the lunches at Central, I only have been to Central, have improved massively from when the district first started. So that's one thing. Another thing I spoke with Mr. Jeff about is we had the competition. I believe there was the competition. I was one of the judges. I was so upset that all young people, and I'm like, I have to grade and there's gonna be a good amount that loses. But if we can try to like put funding away and do something like that, because a lot of the students enjoyed that, the young students enjoyed that. If we could look into trying to do something like that, I think that that would be
Maybe
great
a
for our
club,
district.
Kelly, or something like for kids. We had so many kids that entered in that contest. So maybe we could do like a club or something where like someone from Sodexo can, you know, cook with them. I don't know, just something really cool.
I love that idea. It was really good. They were all fifth graders. They
Keep
were
it on my
adorable.
list of kids clubs. So
And I know, speaking of students, this, you know, going into May, we're Nathaniel Green, we have another group of active students, and there's a partnership with Brown, so we're connecting to meet with them. You know, wherever there's feedback, issues, concerns, we want to be right on top of it, and we want to be addressing it, you know, to the best of our ability. So we're really, you know, putting our best foot forward and trying to meet the needs of the students.
Now, one thing, I know we got to move on. One thing I know, I was speaking with a few individuals with Sodexo. I believe the only thing students do complain about is the amount of food that they can eat. They don't have like a good enough portion that's going to get them like through the day. I know there's like a certain law that you guys have to follow. I know that I think it's sort of like the state would have to give like a waiver. So we can try to probably look into that to see so we're actually feeding our students so they can get through the day. A lot of them have sports after school, so they would like to have additional food. If we can look into that as well, I think that it would be greatly appreciated.
Yeah, there are maximums on portion size and things like that. I came up with at the Parent Advisory Council as well. But I think you're absolutely right. And we do have like snack and after school dinner program, you know, that I think we want to do on a bigger scale. Because all schools have like activities, they have to have enrichment activities. So if there's a homework club or whatever, they should be able to participate in that snack program. So we want to make sure they're getting.
I think we have to advertise it more because I don't think we have a lot of new principals too.
Yes.
So I don't think they know about some of those. So we should probably make sure. Can you put that on my list?
Yeah, and I know
so I don't forget because
you've been helping me a lot get that word out through the newsletter.
Right. That's why
You know, the only other thing that I'll mention, because when I hear that too, it's usually, could we have more chicken nuggets? Could we have a second piece of pizza? The idea with it is there's a lot more sides with the fruits and vegetables, but oftentimes the kids are like, no, I want
believe it or not, the kids
more.
love the salad bar. Like when I went to
That's
JSEC,
right.
the kids
Yes.
were coming up to me with cereal bars. I'm like, why are you having cereal bars? They're like, we miss the salad. And I'm like, you miss the salad bar? Like you would, you know, certainly athletes, right? But they really love that salad bar. So that's why I was telling
because those are
unlimited.
unlimited. They have unlimited size. So
Yes.
that's sort of the
That
thing,
they
is just
want.
shifting what the plate looks like. So I know sometimes, and I understand that they want more, but oftentimes sometimes what I hear is just saying, I want 10 chicken nuggets. You know, not the other things. So we're trying to, through more taste testings and coming up with recipes, engaging them to say, here's 3 ways of including red peppers in your thing. Which way do you like better? And then trying to get them to eat more of some of the.
Yeah, and since those were gone for so long, we kind of reintroducing that. We put out signs that say unlimited, because I think students really don't realize that as well.
I wonder if they can eat breakfast too.
Sometimes
really
not because
hungry.
they're coming in late.
Yeah.
That's
Yeah.
all sweet.
So now I'm really hungry and I want more.
That's
Yeah.
true.
Yeah.
But that's, something we hope to address too with alternative breakfast models. And hopefully next year we can start off
Right.
with that.
They're going through, some of them are going
Yeah,
through growth spurts
you know,
too. I mean, I know I have an 18-year-old, and when he's like, my gosh, how much more can you eat? So I think some of that has something to do with it too.
But we want to at least give them those opportunities at breakfast and lunch and maybe sometime after school so that they can have something for sure.
And can I just mention one thing, which I'll share, but we may not have another meeting. We are doing, so there's a Rhode Island Farm to School network, a statewide network with partners at the RIDE Child Nutrition Program and the Division of Agriculture at DEM and Farm Fresh Rhode Island. And I don't know how many people here have been to the new food hub, the Farm Fresh Rhode Island on the west side at Sims.
Yeah, great.
So that's where the Winters Farmers Market is. Now there's like Tallulah's is opening there. It's this whole new food hub. And a lot of people haven't been there. So they do a weekly farmers market. And we're doing a Rhode Island Farm to School event at the farmers market. So it's going to be on Saturday, June 4th from 11 to 1. We want
Do you have a flyer on that?
so we're just doing it now.
Oh, perfect.
So
You send it to me, I'll-
yep, I will, but I just wanted to say we were thrilled because we were like, here we are in the, Providence, and Providence District is doing so much good news things. So Kelly has agreed to have, some of them you're gonna focus on a lot of the garden parks that you have in the schools and have examples of that and what's going on, in Providence schools around farm to school. So we have a lot of other things too, but fun scavenger hunts for kids, and we have vegetable costumes with the selfie station. There's going to be some fun things. So we'll send that out, but I just want to say Providence will be highlighted there. And thank you again, Sodexo and Kelly. And I just think, again, getting out there to some of the good things that are happening, to the community, because everybody will be invited, but there's going to be a lot of community members there too. And I think people don't realize that, there's a robust farm to school program in the schools here.
Thank you so much, Kelly. Appreciate it.
Thank you.
Last but not least.
I know.
Are these, can I just ask Sandra, because Solite used to put them in, we have a shared Google Drive for like Kelly's presentations.
I'll drop
Okay,
them all.
great. It's great if they go in there, because they are so good and you forget sometimes some of the details.
Well, so there's that, which I don't think I ever actually saw, but also all of these various pieces of presentations and maybe a one-pager for each subcommittee group should be added onto the electronic school board. So, yeah.
Here's like what I say here.
Add
to electronic school board.
Before I start, I just wanted to say a couple things. One, I just wanted to acknowledge Solite. I know she's not here at the meeting, but I just wanted to acknowledge all the hard work she has really done with this committee. It's been very evident as I've been doing what I called my wellness tour for the past couple of weeks. She's been really, thoughtful in a lot of what's been done, and in a lot of cases, I didn't even know some of the extent, which is an issue, right, of the things she was doing. So I just wanted to acknowledge her and thank her. And even before she left, she really, my head was spinning that day. But now since I've met with a lot of you, and I'm still working, I have part 2 meetings. I've really got to understand and know all, the hard work that she's doing. So I just wanted to acknowledge that. And Sue also, who was heading wellness. And as you can see, she's not going anywhere. She's not going anywhere. She's still, helping, obviously, and thinks this work is important. So I just wanted to mention that. And then I just wanted to thank the committee just in general for your patience. I know there's been a lot of turnover, a lot of change. And I just want to say thank you for being flexible. Thank you for welcoming myself and the staff in to really getting to know the hard work that you're doing and allowing me to understand so that way I can better support each of you. My goal is to assign someone from our office to use, but I needed to understand what you were doing and working to know who was going to be the best person. So thank you for that. It's been really great. My secretary at one point said to me, "You need to go to another department. Wellness is just something that's near and dear to me. But she's like, you have to move on to another department. So I just wanted to mention those things before I went into our presentation. So to give you a little bit of idea, this is the structure. This is a brand new office, and I can't tell you how much this office means to me. And I will share a little bit about my background. I've been here in the city for 26 years. Superintendent Martinez and I started at the same time, started as a teacher, and before getting into this role, I was a building principal for 9 years at George J. West. And one of the big things that was really important to me was the social emotional learning of my students. And I did a lot of things with some past board members to really promote social emotion before it was the fad, right? Like now, and Rosemary, you came to see me. And it was just something that was really important to me. So when I was given this great opportunity to be in this role, I knew one of the first things that I needed to do was to create a wellness office and really bring together all of these departments and groups that you see on the screen. And, I know now since COVID, there's been this great, light shined on SEL, which I think is great, but we all here know how important it has been in our district for a while. So with that said, some of the new departments that we have. So other than the wellness office, I also oversee the Office of Multilingual Learners, the Office of Specialized Instruction, and also the Early Childhood Office. And this is a brand new department, and within that, we have our, I'm going to start with Donna, our health, our nursing physical education office, which is headed by Donna O'Connor. And, that office has always existed, so we have her here. We also, for the first time, as part of the wellness, we created an SEL and mental health office or department, which for the first time we just hired Natalie, who I stole from Rosemary. I'm not allowed at any more RIDE meetings because I keep stealing people from RIDE, but Natalie was a great choice. She has been in the district, and she also has, shares a lot of the same passion. And then I was lucky enough to steal from the network Gina, who is our director of school counseling, and traditionally counseling fell in the special ed office, and I removed them from special ed, and I have now put them in our new wellness. And then I also have another piece that also lies here, which is our alternative program and student support. So in this office, we do home instruction, and we do alternative overage and undercredited, our A-Venture program. So they're also in that office. So I'll break that down, and then underneath you see all of the directors listed there. And so here's just, just a quick what our vision and mission is. And, the vision of this office is really to support the health and well-being, not only of our students. It was very important for me, not just the students, but our families, but not just our families, but the staff in our buildings. And sometimes they often get overlooked. And it was really important that we really highlight and really support them because, it's been really difficult for them also in this COVID world. And especially our mental health providers in our buildings. A lot of them have had, they're taking care of everybody else, and they're taking care of multiple buildings. So it was really important to me. So we really, also another thing that was important to me was to work in collaboration with community partners, which are all of you here, in supporting the needs of our students. So that's just to kind of give you a little idea of the work of where we see this office and what our mission is. And it's a brand new office. So we're building this as we're going, which is exciting. And it's been great. We've made such traction already. So I'll go through each of the departments for you so you kind of have an idea of who has been restructured in the department. So here in the health services, you'll see Donna. Underneath Donna, we have the her computational assistant. So that's Ms. Watkins. And then we have her lead nurse coordinator, who I'm sure many of you know, and that's Ms. Barbara Rios. And then we have the COVID coordinator, which is Viviana Nadi, who's phenomenal, who oversees the COVID testing childcare workers that are at the building who've been doing the COVID testing at each of the schools. And then also as part of our office, of the health service office, we have our PE and health teachers also. And we also just have reinstated our teacher leaders, which will help us do some of that curriculum work that we've been talking about in the in updating that work. And then this is just a quick the vision and mission of Donna's department. She apologizes she couldn't be here tonight, but she really, her vision really in her office is to ensure the health and safety of, again, students, but not just students and families, but the staff in the building, while maintaining confidentiality regarding all health information for students. And then her mission, the mission of the office, is to provide comprehensive and appropriate health education while ensuring that schools are safe and healthy environments, so that way students can learn. These are some of the, and believe me, there's so much more we could put on here, but these are the major areas of the work that they're doing. So as you know, the nurses have really taken on this really central role in contact tracing, and I'm glad to say that, thank goodness, has really died down in the past couple of months, so we're so excited about that. And their role is to ensure, obviously, staff and student well-being, monitor any kind of health outbreaks, and provide assessments and services to other health. So getting our vision, our dental screenings, and bless you, all of those back up and running. Physical education and health teachers, obviously providing students with PE and health education. They're also going to be helping us with the Nathan Bruno Act. So as part of the act, it is providing education to not only students about suicide prevention, but also adults in the building. So the PE and health teachers will be taking over that piece for students. And then our SEL mental health office will be taking over that role for the adults, because everybody in the building will be trained, all the way from custodian to kitchen to administrators, everyone in the building. Professional development opportunities, Donna does a lot of those on our PD days, and you heard a couple of examples today, and then also doing some revisions to the health curriculum to make sure we're up to date. And then our COVID team has been working at each of the schools, obviously doing a lot of the COVID testing and assisting with the school nurses. I'll go over this. This is our new social emotional learning department. So this is brand new. So I'll explain a little bit about this. I also did something that was a little odd and has probably never been done. I took our school psychologists and our school counselors and our social workers and moved them out of special ed and put them in this office. And I'm really excited about that. It was a little kind of risky. I wasn't sure how they were going to feel about it, but they have been, it's been really, the feedback's been really positive. So under Natalie, we have the psychologists, social workers, the social worker psychologist leads, and then we also have our coordinators, and Amy is here. We're going to be posting for our school-based mental health grant coordinator soon. Amy has really been like the glue that's held this department together before Amy and I got here, so I have to thank her for that. And so we are really focusing on giving them really professional development targeted to the needs of their role, which is something that they really have been wanting and craving for a long time. So we're really excited about that. And then Gina is our director of school counseling, and she has some school counsel specialists, and there's 3 of those. And then we have school counselor leads and then school counselors. And after this year, we will have a school counselor at every school. Some have more, some have a few more, but the elementary schools this year, not every school has had a full time, but next year they will. So we're really excited about that. And it's been a really great addition to our elementary schools. And it's been great.
Yeah.
We've gotten some really good feedback. So, Natalie, I'll let you share a little bit about the mission and vision. I tried to get Natalie to get that vision down, and she was not having it.
I did, I took a couple out. I have the
She
school
was
bike
not
brain,
having it. She
so.
said, I am not having it. Like, okay, we're gonna work on that.
I need you to know everything. I basically, in a nutshell, it's really looking at how do we not disconnect social emotional learning and mental health from academics, but how do we integrate it and how do we get everyone feeling comfortable and confident and being aware. I think part of it, we can talk about curriculums and this and that, but the biggest thing is that we do this every day. Like we do these different skills, social emotional skills, we apply our own strategies every day. It's really just how do we support the adults and each other and create teams where we're collaborating and appreciating each other's strengths and weaknesses and growing. Like we're all growing constantly as adults. And if we can learn how to do that together, we can model that appropriately for our students. And they can really understand the social emotional. We can talk about the standards and the skills, but it's all about what they're looking at and what they're exposed to in their environment and what they're taking in. And how do we give them a name for that and say, here's a challenge, here's a problem, we're gonna walk through the problem together. I didn't eat breakfast and I'm cranky today, and so here's what we're gonna do, So really trying to build it into just like our core and our culture, and not really focus on here's all of the different curriculums that we're doing so we can just say that we're doing a curriculum. It's really about how do we tie it in and to the academics as well. And sustainable systems, so really tying this to a multi-tiered system of supports and providing a layered continuum of supports and recognizing that it's a system that we support all different layers, levels of need. And how do we appropriately staff that? So we can go to the next teacher. Some of the goals, the really like bigger goals for the grant is the standards. So just using standards to guide our roles and our responsibilities and the services that we're providing. So we adopted the SEL standards and indicators back in 2018. That's the 5 core social emotional learning standards: self-awareness, self-management, social awareness, responsible decision-making. I'm missing one.
Yeah.
Did
you say awareness?
Social awareness, self-awareness, social awareness, self-management, responsible decision-making. But we get it. So using that for teachers, for school counselors, for health and PE teachers, for hopefully report cards, and we talked about this a couple of years ago on this committee. How do we again integrate it into the floss that we just do every single day? We use academic standards. How do we build in the SEL standards into that so people can really put a name to that? The health standards and regulations, so really not separating those out. It's all part of the same piece, that language. And then the national models for school psychological services, school social work service, and school counseling services. So we have these national standards. The principals and admin, we just did a presentation to them. They're not aware of them, and their responses like, how do I know how to support them or use them appropriately, allocate them appropriately if I don't really know what they're trained in. So we went through, there's 10 domains of school psychological services that was just updated. The school social worker, all these acronyms, School Social Workers of America Association came out with a practice model specifically for school social workers, because that's a part, and Amy's been really great with this. She's the social worker brain, and I'm the snake brain here.
Then I have to decide.
You're the admin brain. But one of the things that we are noticing is social workers are coming in and they're doing the best that they can, but they're community social workers. And so how do I apply that work in the school setting? How do I support this? How do I collect data to advocate for my students effectively and work with my families? So really using those to help build the competencies of our professionals. And I know Gina is on the end of the school counselor piece. And how do we really just build that team, that strong team, where they also understand each other's skills and strengths and areas, and where do I lean on you and see each other as the experts that they are in what they are experts in.
And that's really where we've been spending a lot of our time, because we brought these school groups together, but one thing we learned is that they all don't understand what each other does. So our goal is really helping them each understand what each role is, how it is different, but how does it intersect, but more importantly, how do you work as a team to support at your school level. And so that's a lot of the work that Gina, Amy, and Natalie and I have been doing, is helping them to understand that, so that way when they're at their school sites, they're not working in isolation, but working together. And I think the girls thought it was going to be a little easier than what it's been. It's been challenging to do that, but we're already starting to see some progress. So we have to continue that work. But it was also really eye-opening that a lot of our school leaders didn't know all of the different things that they were responsible for. So that was an also important piece too. And we got some great feedback on those sessions where they want more.
And then the second part of this goal, go back 1 second, I'm sorry, and I'll talk really fast, is building that infrastructure and the funding for appropriate staffing of those positions. So the ratio, a national recommended ratio is 1 to 500 for school sites, 1 to 250 for school social workers and school counselors. We would need about 43 school sites and 96 school social workers and school counselors in Providence. Right now we're at 2152.
The counselors
are almost there.
secondary.
So the counselors are almost there.
For secondary,
Yes.
it's the elementary now.
Yeah.
But we just added 18 elementary this year, and we'll have 21 for next year. So
We're
there
about
are a
halfway
few more
there
that
for
we would
yeah.
need to meet that ratio at the elementary level.
Gina and I have kind of started to plan out like what that would look like. But one of the good things is Amy and I were at a conference a couple weeks ago, and they gave us a list of different states, and we were we were top 5, right, Amy? I think we were like 4th.
Yeah, for
in-
school
for
social
school
workers.
social
Yeah,
worker
there's
ratio,
not,
so we weren't that bad.
yeah, not one state has met that ratio yet.
Yeah, but so it's a goal
Maybe
to
we'll
work
be the
on.
first.
Yeah. And it's the third party reimbursement. It's really that funding. There's not appropriations for that level of professionals in our schools. And so it's like these groups that are really going to help hopefully move that legislation to say like this needs to just be built into the appropriations for funding, because we don't have enough funding to support that number of budget positions.
Gina, can you give me those numbers that you know?
Email you the numbers for counselors
Yeah, of what we need. So that we can
to add for the school counselors only, or all the groups?
I can send you the presentation for the grant that has
If we
the
could
numbers
get
in
that,
it.
that'd
Okay,
be
that
really
would be great.
Awesome.
Gina, we have that on our.
The one that,
The one that you have.
That's just for counselors.
Yes, I was right. And then I kind of mentioned this, it's really just like using, again, like standards and this framework to define our work and give us kind of those buckets of where do things fit so that we can advocate effectively, appropriately, and build a comprehensive system of support. This is based on the MTSS state leadership work at the state level of creating the 5 essential components of MTSS so that we can really build a solid, effective system of support. So team-driven shared leadership, creating consistent teams at each school with the purpose of those teams. There's like people trying their best, but there's lots of different teams and we can't really
We have
identify
to
a
build
clear
a
purpose.
district framework. That's another thing that my office is working on. We're really thinking for academics, behavior, and SEL around the MTSS framework, because right now what we're seeing is that a lot of schools are doing different things. So really creating a universal, so that way everyone is doing something that they're doing the same, and that they have these teams to support. So we have a lot of work around that also.
And finding that, and then again, just the consistent programming, that tier 1 universal, what are we using? A lot of people are using some of the same things, but just calling it something different. So how do we really get that language around that? And for families too, so we can communicate it to families to say like, here's what the services and supports we have in our schools, and what are we missing, what do we need? We can't provide that yet because we definitely don't have that consistency.
This is Gina.
And yeah, the comprehensive assessment system just goes along with that. How are we tracking at the universal and targeted levels to make sure we're consistent?
Really quick, the school councils, I believe, are those the social workers or?
No.
I don't know. I was
I'm
thinking-
glad you asked because that's what we're gonna do right now.
Oh, okay. must be.
I don't feel bad. They were called guidance and before, and so now I've had
okay.
to retrain my brain. Nope, school counselors.
Right.
Okay.
we have school psychologist, school social worker, and school
And-
counselor.
Okay, good.
Some schools we have 2 counselors, depending mostly at the high school level, because you'll hear from Gina, they do a lot more with like college and helping them maneuver, like, college, getting the college application, financial aid, and that, so Gina's gonna talk.
Yeah, because I remember there wasn't no guidance counselors in elementary schools, and then
Correct.
we began to add them last year. Okay.
Yeah, it was
This was the
about
first year.
17 years,
Oh, okay.
we haven't had elementary counselors.
Okay.
So, and when we did, there were only a few that
Mhm.
went
That shared
to
school.
multiple schools. So, yeah, very excited to have elementary counselors back in the district.
Are the counselors graduate, do they have graduate degrees?
Masters.
Okay, so and then the social workers also have masters of clinical social work
Yeah,
degrees, but
they're-
it's a different masters.
Correct. They have Masters of Social Work, and they're also licensed through Department of Health, which is part of the reason why they can do the Medicaid billing.
And the school psychologists are masters or doctorate as well.
And we actually have quite a few at the elementary level that are emergency certified that are in the middle coursework, almost done. Some of them are almost
Yeah,
done.
they'll finish this.
They'll be finished
May.
this May, and we still gave them emergency certifications. And Gina and her team, the specialists, have been really helping support as they're still, doing coursework and in the role. And so now at the end of this year, we should have quite a few of them that will now be certified. So that was great.
Yeah, this was great. I mean, just adding 18 elementary, plus we added a few college and career counselors who have the school counselor certification in our high schools through the RIDE Rethink grant. We had so many positions open, and we're like, oh boy, I hope we can fill these, in time for school. So luckily, we started the year filling all those elementary positions. We do have a couple of vacancies now because one person left. And we just had some shifts, like one went to a high school in the leadership role but we hope we have many of them filled right now for next year. So we don't anticipate if that would
Just need to pay them appropriately.
Exactly.
If you're not getting, that's the struggle.
But
That's
we're
another
making some
presentation.
progress.
We are.
We're making
Yeah.
progress. We are. That's one of the other things that Mrs. Moon, we're doing a lot of advocating and also working with HR to help them understand. It's not just like, when a teacher comes and they've done 2 years, at Coventry, and that we have to take their clinical experience in. And so we've been working with them, and it's been great. That's one of the great additions having Natalie on board. She's been really helping them to understand how. So now a lot of those conversations are now going to be applied for our speech and language teachers. And it's another area we need some support with. So that's been a lot of the work that we've been doing the past couple of months. And just this week alone, we hired 3 psychologists. So we're so excited about that. And we have another one hopefully on her way that we'll be hiring. So we're really thankful. So, yeah.
So for our vision, we luckily, through the college and career counselors, they are working with ASPA, the American School Counselor Association, and we received professional guidance from them to come up with our vision and our mission. So with that, Quest counselors support all students tier 1, focusing on 3 domains: counseling, academic, college and career, and social emotional development. So we advocate, of course, for all students. We know the whole child, the whole aspect of the child, not just one piece of it. So when they support students, they're working collaboratively with teachers and parents about all 3 of those domains. For our mission, we promote, of course, self-esteem, provide access for them to become academically successful. So here we have a comprehensive school counseling program. We have a scoping sequence for each grade level. This year with the elementary, it was a draft. We received feedback from counselors. I recently had a work group that I had several counselors attend and go through the scoping sequence by grade level. So what activities, what type of things are we working with students on? So at the elementary school, for example, every month they're going into classrooms. I purchased the Caring School Community curriculum that many of the schools already have, the teachers are using. So the counselors are going into each grade level once per month and rolling out those activities. In addition, individual and small group counseling as well for tier 2 support. And at the middle school and high school level, we have that same scoping sequence by grade level. We base all of our work on data, constantly using
grade data, attendance, with the college piece, how many students are applying for financial aid, which colleges are they applying to? You know, what other programs are they going into? So, of course, standardized testing data, we use this to decide and determine what coursework students should be in, promoting advanced level coursework, concurrent and dual enrollment college courses within our school or outside of our school. And then here are the domains of the counseling office. So tier one, like I mentioned, caring school communities. In the elementary schools, tier two, I purchased zones of regulation, workbook for counselors to provide for individual and small group counseling, and I also did that for the secondary level. So some were already using it, but it's a great resource. And actually, we have May 11th, the morning of the May 11th PD. There's a zones of regulation training for all social workers, counselors, and psychologists.
So this is my last slide, we just wanted to give you a little bit, just a little idea of what we've been doing. So because this is a brand new office, a lot of, and I only started in this position at the end of November, so, and a lot of what we've been doing has been restructuring, and I've been trying to really, when I first started, get an idea of what was out there in the district, how, I can reorg, where would it make sense, and, what would the offices be doing. So a lot of that work has been around that. However, we have been doing a lot of other work too, like under Project Aware that Amy has been running. We just did the Let It Out campaign, which many of you might have seen. So that's been great. Amy has some bumper stickers. If you go on the website, there's a video that was all Providence, pretty much all Providence teachers, students. It was a great video. If we had time, I would show them. We also have our school-based mental health grant, which is great. It was something I had piloted at West, and we continued, where we actually have family services, Providence Center, CYC, Inner U, that are actually in our buildings. And why is that important? It's important because a lot of our families struggle with getting kids, some of them work 2 or 3 jobs, and they struggle getting the kids to appointments, so we bring it to them. And we have the kids get their services right here at the school, and we tell them, during maybe lunch or, special, they take different, opportunities, different times to pull the children, but it really takes that barrier away. So we have that at each of the schools. And that school-based mental health has really helped us to also provide a lot of membership to associations, allowing some of our, we had a team that went to the national conference in Boston, so really investing in their professional development. So thank you to, Rosemary always includes us in all the good stuff. So we're really grateful for those. We're currently looking for an SEL curriculum for K-12. Right now, we're in our researching stage. We want to make sure it's something that is centered around our CASEL standards, which is what Natalie mentioned a few minutes ago. So we're in the middle of researching some options, and hopefully have some narrow curriculums down to share soon. Professional development. We've been doing a lot around professional development, a lot, especially with our administrators and just our team alone. But I'm so excited that I know Dr. Goldberg left now, but Dr. Goldberg, a couple months ago, she contacted me and she said, I have this great opportunity to look around. I don't know, what you think we should do or what we should do, but why don't you talk with? I said, okay, and we talked, and we're so excited. We have a professional development session on May 11th. It's going to be at the Rhode Island Convention Center, and it's going to be centered around our social workers, psychologists, nurses, and guidance counselors and school counselors. I think I mentioned them in choice. It's going to be the first time we're bringing them all together as a group, and we're going to give them lunch, and then they're going to have options. We have four different topics. We had polled them and said, what are some of the things you'd like? So they wanted some things like around ethics. We have some things on teaming. So we have a lot of different options, so they get to choose.
And then after that, they are going to listen to a lecture by Miss Renita
Renard.
Renard.
I know the spelling of the name is
Yeah.
Binaeds.
She's going to be doing, a lecture, and she's going to be doing a breakout session around suicide prevention. And so we're really excited about the event. It's going to be from 12 to 4. And we're going to have classical, high school, their jazz band are going to be playing as people come in. And we're going to have all artwork. Some of our lead social workers, Rose Molina and her kindness crew made for mental health awareness, made some nice artwork. So we're going to put that together and display that. So we're really excited about the event, and we're really thankful to Dr. Goldberg for getting us that experience and hooking us up with Brown. I told them now that they did this, they have to do it every year. So it's like, I don't know, I'm like, please. And we're going to be inviting also some of our communities that participate in school-based mental health, Woonsocket, Situate,
Yes.
Central Falls. We're going to invite, ask them if they would like to give us, a couple people that they'd like to send, so that way they can participate in the learning with us too. So that's really been something we've been working on also for the past couple months. And then the College Crusade, the school board had passed, we do the Accelerate program, which Gina's counselors have been supporting, where we get our, high school students to go in and start taking courses at the college. And that's, something that we've been really excited about in that partnership. So we've been working with the College Crusade too. So we've had a lot of good things happening in the office, and thank you for giving us the opportunity to share. And I just want you all to know that we have very big dreams. I normally have to take them all, 3 of them, and pull them down. We're not there yet, but we have a lot of really great things that we want to come out. We're small right now, but we're a very mighty bunch. And we're really happy to really be doing a lot of this work, because it's so important. It was so important before COVID, and it's even more important now. And the academics will come, but we have to do a lot of our work with the SEL first, so that way they're ready to have those. So we're really excited, and I just had one last slide. I know our time's up. We're really over, but there is no school meeting today. But we just wanted to give the committee a chance to ask us any questions or any feedback or anything you wanted us to think about. Gina's gonna do the note taking.
Gina's like, I'm done.
That's right, I'm really impressed. I have to say.
Yes, that's right.
Really impressed and love. I mean, you can see your passion and energy. You guys are a formidable team. I'm just really impressed with all you've done since making and forming this new office and bringing everything together. So, yeah. Thank you.
This might be a very deep question, but is there a future for the health and wellness coordinator position? Do you see that being filled again?
I'm not sure. In full honesty, I'm not sure. I think what we were trying to do is, which was by tour, to get a sense of what each group, because I think when I talked to Soledad, she had mentioned to me that a lot of things she felt like could never move forward because there was not a admin or someone to kind of move that work. So that's kind of been my hope, that to really assign someone from our team that has that capability, who knows, because we meet as a wellness team once a week to kind of talk about what each group is doing and collaborate, which again is something new that's never been done before. And the point there was to have someone from that team be assigned to each of the work groups to help support with that work. So I don't know is my full transparent answer if that will be, possibly. But for right now, we were going to try to work with it that way, and then kind of see what happens. Because before, it was just Sue and Solite, with the two wellness.
So light by herself.
Solite for years by herself. And I remember there was someone even before Solite, I forgot who it was. Jennifer Quigley, thank you. So now we have a whole office dedicated to that work. So, but I'm not sure.
as the office starts to expand and we start, doing more, that we might, but as of right now, no. But we're only in May. Well, we're getting close to May, so I'm not sure. But we've had those conversations also. I've had those conversations with Ms. Garcia and Dr. Gilbert too about, and when I talked to Soleil too, she thought possibly maybe someone like a part-time because the way the office is set up now. So, that possibly, I guess it's also part of me. I don't want to give it up yet. This is like a really important piece and I want to really grow it. And, maybe as if we go down the road, maybe, yeah.
So so thank you. Are there any other questions or comments for Sandy? No? So this presentation is way more robust than the last time we met. So thank you for that. And you also have a full staff, or almost a full staff.
I
It was also
know.
a big change from the last time we
Yes.
talked.
We've been busy.
Yeah, so thank you so much. So what I'm thinking, to kind of end the meeting with is, number one, thank you all for your patience and your continued commitment to the committee, because it's, I joined this committee, I think, I don't even know anymore. Like, maybe it was a year ago, maybe it was two, I don't know. But I replaced Bobby. And then I asked Dr. Goldberg and Mr. Stevens to join me because I believe that the committee needed more support from the board, and now it has much more support from the district. So I think that all in all, even with all of these various changes, some fortunate, some not so fortunate, we are moving in a better direction. And I feel like we are setting the stage, we can set the stage to really be able to do more collaborative work. And to me, that begins with a little bit of structure and lots of communication. And so let's work together to get our directory updated, to get our subgroups or working groups, updated. I want this information on the actual website. So we have a roster, we have the work group, we have the work group leads with contact information and what your goals are. So each of you, each of the work groups today covered really great information and really great topics that I'd like to hear more about. But are those your actual goals for the next year? Or are those just the things that you're working on right now? And also be able to get these updates out into the public. So unless I'm in a school every day and I don't get to see these flyers and I don't get to see these communications, or I'm not on that listserv, like how else are we communicating with the community? Especially with parents. I love the collaboration with FACE. I hope that continues. But if I am a parent, or I'm a student, or I'm a person working in a community, and I just don't happen to be in this committee, or happen to be in a work group, or happen to be in the room where this information is being passed along, how else can I find out more about it? So we gotta figure that out. How we can do that. And then finally, the cadence of meetings. So we talked about structure, we talked about communicating, and then the cadence of meetings. Previously, we were meeting every other month to allow the working groups to meet every other month. And due to all these changes, we haven't met since December, and so that's not acceptable. We gotta fix that. So for what remains of the school year, can we commit to meeting in May and then also in June, take a break in July, and then figure out what the calendar will be August to September of next year? And in the interim, however your working groups are meeting, because it sounds like some of these conversations are happening outside of working groups too, because you're just naturally in other committees or boards and things together. You all figure it out, but for our purposes, the Health and Wellness Committee, we will meet May, June, not July, and then again in August, and we'll figure out the calendar for next school year. Sounds good?
Sounds good.
Okay.
Do we want to meet the off week of the school board? Or still stay on the school board night?
So we started at 5:00. It is now 7. Maybe if we figure out all of these, other issues with, well, not other issues, but challenges around updating and
point.
things like that, we could cut it down to an hour, but I comfortably we should be meeting for about an hour and a half. Right, by the time people show up, questions, comments, etc., about an hour and a half. I like to begin the meeting at 5:30 instead of 5 to give people a little bit of time after work so they're not rushing here, after 5. And so 5:30 to 7 on a week that we don't have regular school board meeting it would be my preference, unless somebody has an objection. And then moving forward, we'll continue with the YouTube live stream. We'll try to get all of the documents, at the various websites where they need to be, the Google folder, wherever it is, so that we have access to everything ahead of time to review. And then also the public, if you're watching this, they can just click on a button and say, oh, here's a presentation from the Office of Wellness, here's a presentation from, whatever the subgroup was or the working group was, and flyer, et cetera, and it's in one place. Being someone that has had to coordinate all of that information in the past from my various jobs, I know that is a job in itself. So let's just figure out, how the district can support us in getting all of these pieces together and where they need to be. Okay, so I think that's it. Unless there are any other comments, questions, or concerns.
Well, I just want to say I'm very excited. Sandy, you're doing your thing, but you hit it all on the head, and I am excited about this group now. I feel like we have a lot to do and to get to, and I just can't wait for the updates that's going to be coming. So, see Miss Susan Chin back there. I didn't know that.
Hey, Tyrell, good to see you.
But I'm excited, though. I'm very excited with where this is headed. So.
Okay, so finally, we have to adjourn. So is there a motion to adjourn?
Motion.
Second. Is there a second to adjourn?
I'll second.
Thank you. All right, so that's it. So next meeting in May sometime,
Did you
we
get
will
that?
send you the
Tyrell?
I think we had a June one on the calendar already, but maybe it's on the wrong night.
We had it on the 15th.
Yeah.
So the
that's what I meant.
15th conflicts with one of the graduations, so we're actually.
Okay, so that,
So that,
okay.
yeah.
I'll send a cancellation on that one.
Within this week, we'll send out the date for me.
I'll send the cancellation for the 15th. Did you all get the invite that I sent for today? Okay, good.
Yes.
Okay, good. So I'll send the cancellation